Hello and welcome to our session on how to use, reuse, repurpose existing systematic reviews. My name's Dr. Andrew Booth, and today I'm going to be looking at general issues to do with updating systematic reviews, but also how they specifically can apply to their use in an assignment. As you'll be aware, systematic reviews are becoming increasingly plentiful. New studies are appearing that need to be brought together in evidence syntheses. We also see the state of current knowledge changing in a very volatile way, particularly in an area such as health or medicine. And we also want to eliminate research waste by not conducting unnecessary research, building on the shoulders of existing reviews, and being able to exploit the thinking that has gone into their construction. And here are some of the important players in systematic reviews. Some of these names are familiar to you. So, for example, the Cochrane Library, the Campbell collaboration in social, welfare and educational areas, some of the organizations like the Center for Reviews and Dissemination and the Center for Evidence-Based Medicine, and collaboratives like the Joanna Briggs Institute, International Collaborative in Nursing. In the UK, the National Institute of Health Research funds a lot of systematic reviews and also rapid reviews from organizations like ourselves that runs an evidence synthesis center. And in the center here, we have the logo of a very useful resource, Epidemiology, a database that includes systematic reviews, but also identifies the included studies that are present within those reviews. Now, you may well have seen what's called an Epidemiology Bathtub. This is a version that we can use in order to look at issues related to systematic reviews. So I'd like you to, excuse me, conceive a systematic review as if it was a bathtub. In that bathtub are the existing studies on that particular topic. These are the prevalent studies. Some of these studies are good studies when assessed through using a quality assessment tool, and others are bad studies. So if you like, the good studies raise the temperature of the bath, the bad studies cool the temperature of the bath. In other words, the good studies help us to make clinical decisions, but the bad studies sort of dissipate the effectiveness of the review. Coming out of the plug hole, we see the obsolete studies. That's studies that study interventions that are no longer state of the art. Perhaps they are dangerous, or perhaps they've been replaced by new technologies, new procedures. But more importantly, we have the incident new studies. New studies are being published all the time, and if we have chosen a particularly volatile area, it may well be that quite a number of these studies have appeared since the systematic review was first published. We can control this flow of new studies through the PICO, Population Intervention Comparison Outcome. In this particular case, we illustrate that we've controlled the PICO by perhaps reducing the number of interventions we look at. So using the small I for intervention rather than the big I, by reducing to a subset of the population indicated by a small p instead of a big P, or reducing the number of outcomes that we look at as indicated by a small o. But bear in mind that updating a systematic review is not an easy option. It's a very resource-intensive process, and it's very hard to ensure that reviews are kept up to date. Studies that have looked at how long it has taken between a systematic review being produced and an update have found that around about a third of these are updated within 2 years, but more typically that the median update time is more than 5 years. And it's not simply a mechanistic process, a process of just following a recipe. We need to think critically about what was done in the original review. We need to consider changes in methods. We need to consider whether there are new standards, either in the intervention itself or in the conduct of the review methods, or indeed whether the context in which the review was originally conducted has changed. So are there changes in the technology, or are there changes perhaps in the legislation, or in important guidelines? This is a very useful flowchart produced by Garner and colleagues in the BMJ. It's some questions that we ask in order to decide whether there should be an update. So does the published review still address a current question? Did the review use valid methods, and was it well conducted? Are there any new methods that might change how we handle the review? And particularly, will those new methods change the findings? Or indeed, will new studies change the findings or the believability of the review? And these are all indicators for an update. On the other hand, if the intervention is not being widely used, if the research has been superseded, if the article is not being well used, if there are no new studies appearing, or if the studies that have appeared are unlikely to change the review findings, then these are reasons why we might not prioritize update of a particular review. And these considerations also apply within the area of qualitative reviews, qualitative evidence syntheses, in this case exemplified by meta-ethnography, a very useful methods article by France and colleagues, Why, When and How to Update a Meta-Ethnography. And on the right-hand side, we have two examples, including one that I was involved in with collaborators from Barcelona, which not only updated an existing meta-ethnography, but also expanded its coverage and findings. And here is a very useful table from that article by France. It gets us to ask some guiding questions like the aim of the original meta-ethnography. Have there been advances in methods? Was conceptual saturation reached? Are there any areas not covered by the original review that are now covered by studies that have appeared, by new incident studies? We find it helpful to use the analogies from France in that article when considering the case for update. For meta-ethnography, they found three scenarios. They used the metaphor of having a house and what you might do with that house in order to update it. So the first option is to extend and renovate the original house, which means that we add new articles, new studies we've found to the existing meta-ethnography. The second alternative is to do a standalone synthesis just of the new articles and then to compare the findings from our update with the original meta-ethnography. That's like building our new house next to the owner's original house and then comparing those two houses. And then the third option is to just use the raw materials, the studies from the original review alongside our new studies that we found from our searches. And that's like knocking down the original house and building a structure from scratch or from the beginning. And so what we've done here is use those same illustrations to discuss how you might build on an existing review. We've got the options here to demolish and rebuild using materials, to add an extension to put alongside our review beside the original review, to join the two structures together. And the fourth option, which might involve taking a subset of studies and then finding new studies within that subset. and we've called that one downsizing. So if we look at these options in turn, then the demolish and rebuild option, there we only use the existing review as a source for previous studies. So to save time in searching, we conduct updated searches that cover the new period, and very importantly, they overlap so that no studies fall down the gaps between our update and the previous review. We then review the previous and new studies within the framework of a new review. And there are a number of advantages of this. They stop us from a lot of extra work in finding studies. However, it doesn't fully use the review as a product in its own right, but that might be appropriate if the original review is poor quality or uses outdated or discredited methods. The second option is to add an extension, which is to place our new included studies alongside the existing review. And then what we do there is we revisit the analysis and we look at the overall results, the overall bottom line, to see whether they've changed. And it's very important here not just to count the new studies, but to think about their impact, their effect. And this impact could either be in terms of the effect size, changing the overall meta-analysis, or it could change the qualitative synthesis by adding new themes or insights. And so very often we do what's called a sensitivity analysis to see what the effect has been of including the new studies alongside the existing studies. The third option is to join the original review to our new review. The important thing here is to have a structure by which we can join the two together. This could be a linking framework, a linking model, an integrative narrative, integrative tables, maybe a diagram or a figure that brings the findings of both together to make them a joined together structure. But the important thing here is that we don't simply replicate the original methods. We critique them to see whether they are still fit for purpose or whether we can possibly improve upon them. And what we're trying to do here is we're trying to make sure that we do justice to the original review in terms of its quality and findings, but also the new evidence that we've found. The fourth option is the narrowing down, the downsizing, as we called it here. And this is where we focus only on a subset of included studies. So we just use a part of the existing review, and then we build upon that. And so we do two processes. We look for original studies from the original review that meet our new PICO, perhaps, for example, changing the population or changing the interventions that are included, but we also conduct a search for more recent studies that match this new PICO. And then we create essentially a new review that integrates the subset of studies from the original review and the new studies that we found within a new review. And so a good example of this would be, for example, if the original review was on children and adolescents, and we decide to do a review that is on under 5 children only. So we would do a review of the studies from the original review that were in under 5s, plus a review that includes new under 5 studies that we've found from our searching. It's important to remember that if we're reusing an existing review, we'll always need to look at the quality of what's gone on in that review. And this might be assessing the quality of the existing review, the whole review, using a tool such as AmStar or Robis for a quantitative review, or the SBU Sweden tool for a qualitative synthesis. But if we're only using the searching strategy, then we need to assess the quality of the search strategy. If we're reusing an existing review, we'll also need to critique the existing review to say how well it's been done. We could do this in the introduction or background to the review update. We should suggest and actually carry out changes to the existing review methods if they are no longer current or state of the art. And we should also discuss the methodological limitations of the original review and any other limitations of our additional part of the review in our discussion, and talk about the implications that might have for certainty. However, on the positive side, if we're reusing an existing review, we might want to reuse the search strategy, but here we critique it again to see whether we can improve on the search terms used or add additional relevant sources in which to search. It might well be that new terminology has appeared or new index terms have been added to particular databases. We may want to reuse the quality assessments, but we should at least check that this process has been performed in a way that gives us confidence so that we can use the quality assessments alongside our quality assessments of the new studies. And you can also reuse the data extractions, but we should focus on the major summary statistics or the primary themes to make sure that we have confidence in those processes done in the original review. How might this apply to your assignment? If the review is old enough to update and there's more than one new study, then you have two main options. You can update the whole review, and so this may well be that some of the studies in the original review are relevant to your new PICO, and that you found more than one new study through your own search strategy. And so you can then extract the study data from the original papers or from the existing review if done well enough, and then synthesize those reviews together. If you found several new studies through your search strategy, you may decide to use those studies in your own review, and then because there are so many studies in the original systematic review, you may just want to use that review and so include your the existing systematic review as one of the included studies in your assignment. Alternative, as we say, is to update only part of the review. So this is where only some of the studies in the existing systematic review are relevant, perhaps because the existing systematic review had a wider scope, and that you've found either more than one study through your search strategy, and there that's put alongside other studies from the existing review to make up the included studies. And this is very useful where you're finding many new studies have appeared, so much incident knowledge. And so there you can extract data from the original paper or from the existing review. And so you put together the new studies plus studies from the existing review to make the total for your review for the assignment. So in conclusion then, how we can use systematic reviews. We can use them to provide guidance in clinical care, but this requires updates to make sure that we're still reflecting current practice. We can use them to support health service delivery and evaluation, but again, we need to take into account new developments that may have changed how service is delivered. We can use them to inform future research, including our own assignment, helping us to scope our question and perhaps narrow it down to a subset of studies. But you need to consider what you'll be reusing. So will you just be reusing the identification of studies? Will you be using the original methods, but will you therefore be including some of the limitations of the original review? Can those methods be improved? Or will they still apply? And then finally, how does the new evidence that you have found impact on the original analysis and interpretation? Do the take-home messages still apply? And do the findings still summarize the overall state of the art, the overall picture, when you put together both previous and new studies? So certainly updates to systematic reviews are an extremely useful activity, but they have to be performed with caution, using the same analytical skills that you need in order to conduct review from the very beginning.